Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Now, public health policymakers are not only dealing with daily rising COVID-19 cases, but they're also dealing with an evolving SARS-CoV-2 pathogen, as well as supply bottlenecks from vaccine nationalism. So how do we negotiate these challenges on multiple fronts? By tackling them one by one. Tonight on the show, we're going to be doing precisely that, and we're going to begin with Sibrandes Poppema, who is the president of Sunway University. He is a Tan Sri Jafri Chair Distinguished Professor, trained as a pathologist and holds a doctorate in immunopathology. Good evening, Professor Poppema. Thank you so much for joining us on the show tonight. Now, I would like to begin our conversation by taking a look at how quickly COVID-19 pathogens are evolving. Now, the Lancet, which is the leading medical journal, has recently just published a report that says that SARS-CoV-2, the virus SARS-CoV-2, is primarily airborne, and this contradicts the current thinking that droplets, which land on surfaces, are what spreads the disease. So, what do you think of this? What do you make of this? And what are the implications, do you think, of this assessment?
Yes, that's... In fact, this is something that has been suspected for quite a while, particularly also in China. In the beginning, there were already investigations that showed that the virus was also present in the air, for instance, in air vents and so on. So what it means is that the original theory that was guiding us to a large extent, which was that it was mostly by droplets, is not the whole story. It's not the case that it's not true. It's also through droplets, but probably much more important is the virus being airborne through our breath. And that's how it can move much farther than when it's moved in droplets. You know, the whole 1 meter thing, 1.5 meter thing, was all about how far droplets could travel. And what is clear is that that's not a whole story. There are several lines of evidence that show that it can move through the air. You know, when you think about some of the major outbreaks, which were with choirs, which were in sports events and so on, it's clear. You know, also another example is that people in adjacent rooms that never met each other in quarantine centers actually got infected. And that could only happen through the air. There's also animal experiments where it's been shown that when you put animals in cages far from each other, but only connected through an air vent, that they can be infected. So this indicates that in addition to droplets, and maybe even much more important than droplets, is this airborne infection. And what it means.
Right,
yes?
Professor Poppema, if you could help us understand, are the implications mainly on the public health procedures that we must put in place in order to deal with this new shift in the theory of the sense that the preponderance of infections are coming from this particular dimensions transmission? Are there other implications, one to do with the virus itself?
No, not so much other implications, but what it means is that we now understand much better how dangerous it is to be inside, because inside, when there's not enough ventilation, the amount of virus will build up. And so it's very important to not be with large groups in poorly ventilated, enclosed areas. So it's much better to be outside. So that's one important thing. It also shows that mouse masks are even more important than we thought, and that the quality of the mouse mask is extremely important. So I think that's where the major things are. Right.
Professor Poppema, do you think that, you know, I know that, you know, science will have to keep catching up to, or the research will have to keep catching up to how quickly the science is evolving. I'm wondering whether governments and corporations are doing the same when and policymakers are doing the same. Are they doing enough to keep up with the changes in the pathogen?
You know, when it comes to this question, I think that the policies have been right. So wearing face masks, what we have been doing here in Malaysia, you know, right from the beginning, was one of the important things. I believe that that is one of the reasons that we've been doing much, much better than most countries in Europe and in America, where they were much less stringent with face masks. You know, my own home country, the Netherlands, had much, much higher numbers of infections, much, much higher number of deaths. And the major difference has been not wearing face masks. For a very, very long time, people denied that wearing face masks was important. And that's been the big difference between, you know, many countries here in East and Southeast Asia, where people were wearing face masks, and countries in Europe where they were not wearing face masks.
Professor Poppema, when we think about the variants in the virus itself, and your kind of own field of study, is there something unusual about this particular virus that marks it out from other pathogens that human societies have had to deal with for millennia? What do you see in it that is unique and that's troubling?
It's not so different from other viruses. The big difference is that we were meeting this specific virus for the first time. And it means that you know, we had no resistance against this virus. So that was step one. That's why many people, when they become infected, they get sick. Now the variants are because anything that's dividing, including the viruses, when they are reproduced, are making mistakes. And this is an RNA virus, and RNA viruses do not repair mistakes. So the mistakes accumulate. The number of mistakes in this virus is not extremely high. You know, it's much lower than, for instance, in influenza virus, but still it's accumulating. And that is the big danger, because the longer this pandemic goes on, the more mutations will develop. And some of these mutations are ones that do one of three things. They can be more infectious, they can cause a more serious disease, and then the worrisome thing is they may also make the virus escape from our immune response. So both people that had the disease before may no longer recognize this new variant virus well, or also after vaccination, you may not recognize the virus very well. So those are the three dangers of these variants.
Can I ask you to elaborate on that? This is particularly within your fields. I mean, what is it that we know at the moment about these variants and the way the human immune response is resilient towards this virus or these variants, and the protection that we may have for reinfection? What is it that we know at the moment, and what is it that we still don't quite yet know for certain?
Okay, so you know, our immunity consists of two major parts. One is the cellular immune response. These are the T lymphocytes that need to recognize the virus, and the other one is what's called the humoral immune response. That's the antibodies. And what we've been measuring particularly is these antibodies against the spike protein. And the spike protein is the part of the virus that's responsible for entering into cells. So it's important to have antibodies that will recognize this spike protein. That also is why nearly all of the vaccines consist of spike protein. So we want an immune response against those. Now, the variants that are dangerous are the ones that have mutations in this spike protein. And many of those mutations will have no effect. The majority will have no effect. But some of these may change the spike protein in a way that It can even enter better into human cells. So the key lock situation, if the spike protein is the key and the lock is on the cell, the fit gets even better. So that's one possibility. The other one is that a virus is more dangerous, cause more serious disease. So far, we've not seen that. But the first one we've seen, for instance, with the South African one. And the third one is that it may escape immune response. And there are indications that that's happening. So again, the South African virus, some people that had the disease before can be reinfected with that virus. Not frequently, but in some people this will happen. And the same is that with some of the vaccines, so that's been shown for the AstraZeneca vaccine, for instance, is that people that were vaccinated, their immunity against this variant is less than against the original virus. And the reason is that the spike protein has changed and cannot be recognized as well as it could be recognized before.
Professor Poppema, do you think, as many of us hope, the vaccines and the whole range of them might end this pandemic and return us to some form of normality that we knew only a year or so ago? Is that a sentimental view? Are you less or more optimistic than the average person?
I'm a very optimistic person, so let's be honest about that. But I'm less optimistic than I was, let's say, half a year ago when, the vaccines came. And the major reason is that the rollout of the vaccines is not going as quickly as one would hope. So when you look at the production capacity, if, half a year ago, 3 months ago, very optimistic because nearly all of these vaccines that were being produced turned out to be effective and have very little side effects. So at that time, it seemed that, we ramp up the production and we can vaccinate very quickly. Now, it turned out that ramping up the production for several of them did not go as easy as one had hoped. So, AstraZeneca, Johnson & Johnson, they have had problems increasing the production. So that was one big problem. And the second one has been that people have gotten very worried about some of the side effects. And really with those side effects, one should stress that they are very, very unusual. It's a very, very low percentage of people that gets a side effect. If you look at the thrombosis with AstraZeneca and apparently also Johnson & Johnson, if you look at the frequency of that, it's so much less than the frequency of thrombosis in people that have COVID infection, or in people that smoke, or in people that are using the anti-conception pill. So the frequency is really low. And I believe that we should accept that side effect and, in fact, vaccinate people, also with the AstraZeneca, because that will save many, many more lives. And so it's really important to, vaccinate, and vaccinate, because when we don't, the virus will catch up with us. Right. Eventually, there will be more mutations, there will be more variants, and we will have less resistance against the virus.
Professor...
Then we will need to revaccinate with different vaccine. So there's just one solution: vaccinate as quick as possible.
We hear you. The urgency is there. And thank you so much, Professor Poppema, for speaking with us tonight. It's been such a pleasure, and thank you for helping us better understand this evolving pathogen. We appreciate your time. We're going to take a quick break here on Consider This, but more on this topic in just a couple minutes. Stay tuned.
Data percuma bermula
untuk memastikan Malaysia ada ke depan kita boleh maju. Induknya adalah Melayu.
Balik kepada Islam. This is orang yang membuat polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita, sudah tentu dia akan datang daripada pemimpin wanita.
untuk memastikan Malaysia ada ke depan dan maju. Hentikan induknya adalah Melayu.
Balik kepada Islam.
Bukan orang yang membuat polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita sudah tentu dia akan datang daripada pemimpin wanita.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah. Podcast dikemas kini dengan berita dan program.
Rebirth, Reformasi, Resistance and Hope.
Serta video tanpa had dengan scroll tanpa henti. Buat turun aplikasi baru Astro AWANI sekarang.
Semua yang terjadi adalah berita, tetapi tiada siapa yang boleh bawakan yang terkini dan tergempar seperti kami.
Dilihat hanya memberi wang tanpa matlamat yang tepat.
Dia tidak melakukan apa-apa kesalahan.
Untuk mendapatkan jawapan yang bermakna, kita perlu soalan yang tepat.
Amat sedih dengan apa yang berlaku ke atas.
Tiada ruang untuk berita palsu.
Negara kita telah merekodkan kes harian baru sebanyak
hanya fakta yang diberikan.
Hi, thank you so much for staying with Sharaad and I on Consider This. Let's continue our conversation and our look at the medical and political dynamics underpinning the COVID-19 pandemic. Joining us on the line now, we have Dr. Muhammad Farhan Rusli. He's an assistant professor of health policy, economics and finance at the International Islamic University, Malaysia. He's also director of the Selangor Task Force Operations. Dr. Farhan, thank you so much for joining us on the show today. If
Hi, good to be back.
could ask you about a statement made by the Health Ministry today in which it noted that the COVID-19 cases that have surged, in many countries, not just in Malaysia. And I was wondering if I could ask you about that. In your view, is that a sufficient explanation for our rising COVID-19 numbers?
I think one of the biggest things that we have to see is that we have this tendency of always comparing ourselves to something which is worse. So whenever we say that our numbers are higher or getting high, we always say, look at this country, they are much more higher than us. We tend not to look at countries which are doing better, but we compare ourselves to the countries which are doing much worse. So definitely that's not a clear answer. Because at this moment of the pandemic stage, they should be clear-cut in explaining exactly how the numbers are increasing and where are the numbers coming from, specifically, and being very intricate in the way they present the data.
Farhan, is the reason why there's hesitance on the part of policymakers and government officials to do exactly what you just said, that there might be policy implications coming out of that? If they were very specific about what's going on, then they would have to act in a way that is perhaps different from what they're doing today.
I think what you said there, Sharaad, is very interesting, because now you have to ask, right? If you have to be intricate in the way you present the data, that means you have to act on it. And that's where we have to start asking ourselves, are they acting on the data that's being presented? However, one must also ask this question: how sensitive or how accurate is the data that's being presented to us? Because as you remember, what happened to us in, I think, late January and early February, where we saw a surge in number of cases up to 5,000, they admitted that that was because of a backlog in the number of reported cases. So now the question that we must ask now is, the data that is presented today, these cases are reflecting when, where? I'm sure it's not the 2,000 cases today that happened. Was it 5 days ago? Was it 7 days ago? This is why we have to be clear. And the cases that's being presented every day for the whole country to see must be tailored to when was the samples actually taken, so that we can actually see whether this data is actually usable or not. Because if you present me a data which is, 3 weeks old, 2 weeks old, what's the point?
Right. If I may move the conversation to look at the national COVID-19 immunization program. So today is the second day of phase 2, and there was news today. It was reported today that on day 2 of the second phase in Cebu, that this the national immunization program had to be postponed because of a lack of vaccines. Now I'm wondering whether this news struck you as somewhat odd, given that day 1 reportedly went well, when according to plan, over 1,000 people were vaccinated or received their vaccines, but day 2 they had to stop it for the lack of vaccines. What do you think happened here?
I think the way things are going now, I don't find anything odd anymore when it happens. Is it surprising? No. Because why? Because of the mechanism on how the vaccine rollout is. Now we have to start asking ourselves, how do these people actually get appointments? And who are the people who actually are tasked to give these appointments? Is this the health district office? Is it the state health district office? Or is it the federal level where the CITF gives the vaccine appointment dates? If you ask me, I'm sure different people at different levels will give you different answers. And that's where the problem stems from. It is in the improper governance on the vaccine delivery that will actually hinder the way we actually roll out the vaccines in our country.
Farhan, is it too late to turn things around? Is it too late for us to recalibrate the governance and make it coherent, and so that you don't have a situation where people are turning up at the vaccination center and have no vaccines? I mean, one assumes that if X number of people have been called to receive vaccines, that X number of vaccines are available for them. Is it too late?
For me, I always go with this principle, better late than never. So definitely we need to all press this reset button, whereby we need to recalibrate and re-stratify. Now imagine if we have these issues stemming when we are early on, that we must be able to rectify, and we must not stand up or sit on our high horse and keep on pushing through something that has a systematic failure that's happening. And if we cannot deal with this small number of vaccines on our hands, how are we supposed to accomplish what the health minister said? Vaccinating 150,000 people a day, or was it 75,000? I cannot remember what's the numbers because they keep changing. But as of now, we have problem with 1,000 vaccines. How do you expect them to go ahead with what? 1 million doses?
I want to ask you about the behavioral dimension, particularly with the way we citizens interact with the My Sejahtera app. And there's been some glitches that we've learnt in phase 1 that hopefully will be worked out before we really get going into phase 2. What do you think of some of the lessons that we can learn from the behavior of stakeholders in phase 1 that we may need to address and rectify going into phase 2?
Okay, first of all, we have to understand that not everything that we plan and execute is actually guaranteed to be bulletproof or foolproof. Definitely, we will have some sort of stumbling blocks or issues that will arise from us rolling out any plan or policy. Now, when you're talking about My Sejahtera itself, definitely, if you compare them to what it was last year, which was just an over-glorified QR scanner, right now we can see that there are some sort of improvements that's coming along. However, we think that it must be much, much more better in the way that it's being used for this vaccine role implementation. Because now the stakeholders must realize that can it be the app itself that's making people not able to register themselves as easy as it would be? Because you start giving out plans according to what you think is right, but not what the majority of the people think it's useful. For example, my simple question is this. My Sejahtera, is it available in other languages or is it in English only? What about Bahasa Malaysia? What about Mandarin? What about Tamil? Are we sure that everybody in our country is English literate? Now we have to start thinking about all these small things which actually plays a role in getting these people to be enrolled.
Farhan, speaking of stumbling blocks, leader of the opposition has come out to suggest that, states like Selangor and the territory of Sarawak, which have stated that they want to get their own vaccines, procure their own vaccines, have been blocked by the federal government. What do you make of that criticism, and where do you stand on the question of whether vaccine procurement should be a centralized effort, or if it could be distributed through private service providers and such in order to maximize the effectiveness of the vaccination program?
All right, so now we see that the centralized effort is quite pathetic. So let's just be honest here, right? And call a horse or an elephant, right? So the question that we must ask is, for all this while, where have you been getting your influenza shots? Where have you been getting your pneumococcal shots? It has always been at private GPs or private hospitals. And we have never had a problem or issues such as fake vaccines or physicians giving false or improper vaccinations, because it's such an easy process. So the question is, when it comes to relation to COVID-19 vaccines, why not use the time and tested method of using private GPs and making them be able to procure, state governments making them be able to buy? Because isn't the end game trying to get as many vaccines into the arms of people as fast as possible?
That's true,
if
Dr.
that's the end
Farhan,
game,
but
right?
what do you make of the counter-argument to that, to say that by allowing multiple parties to procure vaccines, that could heighten inequality, that could derail the plan, the national immunization plan? What would you say to that?
Imagine if you only had one cook in the kitchen in a fast food chain. How fast will you actually get your food out? It's as simple as that, right? The more cooks you have, it's not going to spoil the broth in this case, because it's already cooked, prepped food. All you need to do is just hand it out to the customer. It's as simple as that. And what we have to do is get as many stakeholders roped in to get the vaccines. If they're able to buy it, good, go ahead. Let the states buy it by themselves. They're not asking for money from the federal government because the states have money. Let them purchase it. And the more vaccines are there in the arms of people, the faster that we get to the herd immunity for the country.
Farhan, what is Selangor going to do in view of the inability or incompetence, however you like to characterize it, of the federal government at this point in time with the vaccination program? Is Selangor going to find some way around this, or is it stuck because the approval process is still a federal one?
Yes, the approval process has always been federal. And the Selangor government has always been proactive in trying to provide a sense of complementing whatever the federal government is trying to roll out. We have rolled out our Immunicell, whereby we actually go out to the grassroots to get people to be registered into the vaccination process using their MySejahtera and using their platform. And what we're trying to tell the federal government is, if you would like us to help you to get these things done faster, why not open your doors? Let the state government purchase. And let the state government inoculate these people and put the vaccines into the arms of the people. Why are you so afraid or have this big mistrust to not let state governments roll out their vaccination policies?
Okay, very quickly, I wanted to ask you, desperate times call for desperate measures, drastic measures, if I may. And there was a comment made by the coordinating Minister for Vaccines, Khairi Jamaluddin, saying that, COVID-19 vaccines could become mandatory if Malaysia's vaccination campaign reaches a critical point in September. This could be an option. I'm wondering what you make of that.
All right, I'm just going to summarize it really well for you, Mel. So we have never been a proactive population in the first place. So most Malaysians always adopt this wait-and-see approach rather than being completely autocratic. What the federal government needs to do is not tackle the issue from the side, only from one side of the fence. So what they should do is that instead of making it mandatory, is that every single Malaysian citizen who is actually eligible to receive the vaccines is automatically registered. In this way, tomorrow you can announce 27 million Malaysians have now registered or are now eligible for vaccines. But allow them have an opt-out mechanism and ask these people questions. Why would you be wanting to opt out? Instead of getting people in, why don't you ask them why you want to leave? Isn't that more it's really much simpler in that sense if you see it.
Farhan, thank you so much for speaking with us tonight. We appreciate your time. And a pleasure speaking with you. That's all we have for you on this episode of Consider This. But before we leave you, a reminder, you can get all the latest news and information on COVID-19 vaccines at astroawani.com and the Astro Awani app. Thank you so much for watching. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
We will be back with you same time tomorrow. Till then,
good night.
Good night.